Hello, good evening. Today we will see what is medical coding. So we all know about medical insurance, but how it is being processed. For that only we need the help of medical coding. Medical coding is nothing but a translation. What is this translation? What are we going to do here? Like the medical coders who are working in the hospitals or in the clinics will convert the medical reports of the patients into a set of codes, and that codes will be submitted into the insurance companies for medical claims or reimbursement. So that is what is medical coding is. So if you want to know more about this medical coding, please continuously watch this video. So let me explain what is this medical report first. Just imagine that a patient is going to a hospital. So when the patient is going to a hospital, what the doctor will do? The doctor will first examine the patient, and after examining the patient, he will find out what problem the patient is having. That is what is diagnosis. So doctor, after examining the patient, is coming to a conclusion about the patient's condition, and that is diagnosis. Once he has reached the diagnosis, he will be giving some treatment. So that will be the procedures which are done to give treatment to the patient. So both this diagnosis and the procedures will be mentioned in the medical reports of the patient, and all of them have to be converted into a set of codes. And those codes are actually alphanumerical, which is provided to us by an organization called AAPC. So it is an American institute. They are the ones who are doing everything in relation to this medical coding. They only introduce this into the medical field, and with the help of that, now the medical industry has developed a lot with that. Okay, so if you do this, if you learn this medical coding, what is a certificate you will get after completing this course? You will be getting a certificate stating that you are a certified professional coder. So you will become CPC. So AAPC will be giving you the certificate named as CPC. So once you complete this course, you will be getting a certificate that says you are a CPC. And this certificate is actually valid worldwide. Most of the countries are following this American coding system, and many of the countries provide job for people who are having this valid certificate of CPC. So you can get work at any part of the world. It can be India, it can be US, it can be UAE, or it can be Philippines. Like that, there are so many countries. So now, if you learn this medical coding, what is the scope where all a coder can work? A coder can work in a clinic or a hospital, and also in insurance companies or revenue cycle management. What is this? Clinics and hospitals and also insurance companies, why they need this medical coders? Clinics and hospitals need the medical coders to convert the medical reports into codes. The insurance companies and the revenue cycle management need the coder support to convert or verify the codes that are submitted by the clinics and hospitals. So that is the purpose of coders at both ends. So there is a chance of getting jobs in clinics and hospitals and also in insurance companies and revenue cycle management. Okay, now let us go into the details of the books, what we are going to use in this course. We will be using 3 books, and the first and foremost important book is called CPT. And as you see on the screen here, it is CPT 2024 for this year. And the next book is ICD. It's ICD 10CM, that is also 2024 edition. And the third book is HCPCS Level 2, that is also 2024 edition. Because every year, this AAPC is introducing a new book, and the revised edition of new book will be provided to the coders. Now we will see in detail about each and every book. As I told you, the first book, CPT, Current Procedure Terminology. CPT, expansion is Current Procedure Terminology. From these words, we can get an idea that this book will be giving you the procedure names up to date. That means up to date, whatever procedure is done in a hospital is having a name, and also it is having a particular code. So that can be picked up from the CPT book. So what is this procedure? What are the kinds of procedures that are coded with the help of CPT? Just imagine a patient is coming to the hospital. The doctor is doing some testing. For example, it can be an X-ray or it can be a lab test. So both of them will be called as a diagnostic procedure. So diagnostic procedures will be coded with the help of CPT book. And also, if the patient is getting some treatment, for example, it can be a simple injection procedure or it can be some complicated surgical procedure, whatever it is given to treat the patient. That is called as a therapeutic procedure. So both diagnostic procedure and the therapeutic procedures will be coded with the help of CPT book. Now we will see about ICD book. What is this ICD book? This book will give you the codes of all the diseases, and the expansion of ICD is International Classification of Diseases. And this book is actually given by the WHO. Every year they are giving us a new book because they have to include all the new diseases in it. So there is a vast classification of diseases in this book, and this book will be used for coding the diagnosis. As I told you before, diagnosis means it is the finding or the disease what the patient is actually having at the time of hospital visit. So that is about ICD book. And the third book will be used for reporting something called as medical supplies. So what is this book? The third book is HCPCS, Healthcare Common Procedure Coding System, and this is actually level 2 HCPCS book. This will be used for coding all kinds of medical supplies. What are medical supplies? The materials that are used in the treatment of a patient. For example, I am giving my patient an injection with a medicine of painkiller. So I'm using two things here. I'll be using a syringe and the medicine. So I can pick a code from this HCPCS book to code that syringe and also the medicine that are used for the patient. So that is HCPCS book, what we use for. So now on the screen also you can see one example which I have given there. Just imagine that a patient has come to a treatment of fracture to the hospital. So in that case, doctor will be providing something called as a casting. So this casting is provided as a treatment for the fracture. So for this, doctor will be using some materials. So those materials can be coded with the help of HCPCS book. So this is how we use a third book. Now, in a practical scenario, how we are going to use all the three books to explain the visit of a patient to a hospital. Just imagine a patient is coming to the hospital with severe pain and swelling in his or her hand after he met with an accident. So first what the doctor will do? The doctor will first evaluate the patient. That means examine the patient. Physical examination will be done first. And after doing the physical examination, if the doctor is suspecting some internal injury, he will be taking an X-ray to find out what is the problem inside. And here also, the doctor is taking an X-ray. After looking into the X-ray, doctor is finding that patient has got a closed fracture in the forearm. So this closed fracture in the forearm and all we can learn later. But as of now, you just think that it is a fracture in the forearm. So now he has confirmed that there is a fracture and doctor is giving treatment to the patient. That is done with the help of plaster casting. So now in this scenario, what all things have to be noted? The diagnosis here is a fracture and that will be reported with the help of ICD code S52.0. This is just an example. Like this, we have so many codes in ICD that will be used for coding diagnosis. And in this scenario, doctor took an X-ray first and then he gave a casting. So for this X-ray and the casting, we will be reporting CPT codes. For example, it will look like this. 73090 is a code for X-ray and 29075 is a code for the procedure of casting. And thirdly, he used the materials for the plaster casting. That will be coded with the help of HCPCS. So HCPCS book has given us a code for the plaster cast material and the code will be looking like this Q4021. So this is how we use all the three books together to explain the visit of a patient to the hospital. Now, in further detail, I will explain what are the topics that are covered in this book. The first book, what we are going to see is CPT. As I told you before, CPT book will be used mainly for coding procedures. It can be diagnostic or therapeutic. So we are going to use CPT book for coding the procedures. So what is this book having in it? This book is having three categories of codes: category 1, 2 and 3. Category 1, 2 and 3. And we will see about category 1 codes first. Category 1 codes are the most important category in CPT, and this will be regularly used for coding purposes. So what is this category 1 codes and how do they look like and how we are differentiating it into different chapters? We will see that one by one. Category 1 codes are always numerical. Numerical means it contains only numbers. There will be 5 digits, only 5 numbers. And each and every chapter will have a particular starting number to identify the chapter easily. So for the ease of coders, this book is designed like that. Every chapter will have a particular starting number. And as I told you before, this is regularly used for the coding purposes. The code that will be looking in the category 1 section will be having only numbers, no alphabet. For example, 1, 2, 3, 4, 5. So this is a code of category 1 section. So now in further more details, I'm going to explain the topics that are covered under this category 1 section. So what is this first topic in category 1? It says it's evaluation and management, and shortly we say it as E&M. From this you will get 6 questions in the exam, and the codes in this chapter will always start with number 9. So what is this evaluation and management? Based on where the patient is being examined and treated. This is mainly helping us to code the place of service. Place of service means, for example, the patient was examined by a doctor in an outpatient clinic. You will be having a different code. Or the patient was examined in an inpatient ward. You have different codes. So this evaluation and management chapter will mainly give you the codes based on the place of visit of the patient. And one more thing I wanted to say, 9 series of codes not only belong to this E&M chapter. There is one more chapter that is called as medicine chapter. This chapter will also start with number 9. So both these chapters, first chapter and the last chapter in CPT category 1 will always start with number 9 series of codes. But in E&M, the code set will be 992022 to 99484. All the remaining codes belong to medicine chapter. So now we have seen about the first topic. We'll move to the second topic. What is the second topic? The second topic is anesthesia. Anesthesia, meaning of anesthesia is lack of pain or sensation, or absence of pain or absence of sensation. Whenever a doctor is doing a surgery or a procedure in a human body, he should make sure that that human or the patient should not feel any pain. And for that, doctor will be giving a medicine called anesthesia. And this anesthesia is given as general anesthesia to make the patient unconscious during the procedure. So all the general anesthesia procedures will be coded with the help of 0 series of codes. So for example, 00100. So whenever a code is starting with number 0 from CPT, it is understood that it is an anesthesia chapter code. Now we are moving to the third chapter. That is a very important chapter, surgery. Surgery. We can do any kind of surgery in the human body. I can do a heart surgery, I can do a brain surgery, any kind of surgery. But all the surgical procedures will be covered under this topic. But this topic is further subdivided into 6 subdivisions according to the body system. And the codes in this surgery chapter will always begin with number 1, 2, 3, 4, 5 and 6. And from this totally we get 36 questions. That means from all the subdivisions you will be getting 6 questions. So now we will go into the subdivisions. So the first subdivision what we are going to see under surgery is skin, because that is the first organ of body which is seen outside, that is covering the entire body. And medical term for the skin is integumentary system. And whenever a surgical procedure is done on the skin, it will be coded with the help of one series of codes. So the skin chapter code will look like this, 15876. This is just an example. So all the one series of codes belong to procedures that are done on the skin. Now, below the skin, what do we have in our body? We have muscles and bones. So that comes under the second chapter, musculoskeletal system. So muscles and bones, whatever procedure we do, that will be covered under two series of codes. Two series of codes, that is 29870. So now we'll move on to the third chapter. We have seen skin, muscles and bones. Apart from skin, muscles and bones, what else our body has got? Our body has got so many internal organs. So we have to learn about them also. And out of them, the third chapter will cover respiratory and cardiovascular system. What is this respiratory and cardiovascular system? Respiratory means it's related to organs that are involved in breathing, starting from the nose till the lungs. That is covered under respiratory system. Cardiovascular system. Cardio means heart, vascular means blood vessels. So heart and the blood vessels which are doing the function of circulation of blood will be covered under this. So both respiratory system surgeries and cardiovascular system surgeries will be covered under this three series of codes. Next we'll move to the next system, that is called as digestive system. What is this digestive system? Digestion is a common word which we use for the food digestion. So organs whichever is involved in the digestion will be covered under digestive system, starting from the mouth till a structure called anus. Anus is the terminal opening through which the poop or the food waste comes out. So digestive system will cover all the organs from the mouth till the anus. It can be stomach, it can be intestine, it can be liver, but whatever procedure is done in the digestive system, it will be coded with the help of four series of codes. So now we have seen till 4, now we are moving to the 5 series of code. Apart from respiratory, cardiovascular and digestive system, we have some more systems in the body. One among them is urinary system. So the excretory system in our human body, which is doing the function of removing fluid waste, that is urinary system. Organs like kidney, urinary bladder and ureter, all those will be covered under urinary system. And also in close relation to the urinary system, we have male and female reproductive system or genitals. So that is also covered under 5 series of codes. So whenever a code is starting with number 5, I can blindly say that it will be either from urinary system or from male and female reproductive system. And if you want to furthermore specify, then you can check the list of codes that is mentioned below urinary system. Urinary system means the codes will be 50010 to 53899. Male reproduction means it starts with 54000 to 55899. Female reproduction means 56405 to 58999. So like this chapter is divided. So all the 5 series codes belong to urinary male female reproductive system. Last but not the least, we have the 6th chapter that covers nervous system. But this is a very important system which is controlling all the other organs in the body. Brain and the spinal cord, which is controlling the whole human body, is coming under this nervous system. And in addition to this, we do so many procedures on eye and ear. So they have covered the 6 series of codes with nervous system and also eye and ear chapters. So whenever a code is starting with number 6, it is understood that it is either from nervous system related to brain and surgery or procedures done on eye and ear. So this is how the surgery topic is further subdivided. So we have completed all the topics under surgery. Now we'll move to the next important topic, that is radiology. So what is this radiology? Radiology means it's study of radiation. And in this topic, again, you will get 6 questions. So in this topic, what we are going to learn? I told you it is study of radiation. We use radiation in the medical field for 3 different purposes. One is diagnostic procedures. For example, we do X-rays, scans to find out the problems. Second one is therapy. That means using radiation as a treatment for cancers. So radiotherapy. And also we use radiation as a guidance for some procedures. Guidance means scans and X-rays will help us to do some complicated procedures inside the body. So those are the things that are covered under radiology chapter. And the codes in this chapter will always start with number 7. Will always start with number 7. So for example, 75898 is a code from radiology chapter. So now we'll move to the next chapter, that is pathology. What is pathology? Study of diseases. From this again you get 6 questions. From this again you get 6 questions. So what is this pathology going to deal with? Whatever lab procedure is done in a patient to find out the disease, that is covered under pathology. So when a patient is coming to the hospital with some internal problems, doctor will be doing some X-rays or scans, or he will be doing some blood test, he will be doing some urine test, or he will be suspecting something and ordering a biopsy. So all those procedures which are done in the lab to find out the disease will be coded with the help of this pathology chapter. From this again you will get 6 questions, and pathology chapter codes will always start with number 8. So whenever a code is starting with number 8, I can easily say that it is from pathology chapter. That is how the CPT codes are designed. Now we will go to the last topic under CPT, that is medicine. As I told you before, the first and the last topics of CPT book will share 9 series of code. That is E&M and the medicine. Both of them will share 9 series of codes. And from this again you will get 6 questions. And what is this medicine? When a patient is coming to the hospital, not necessarily we have to do surgical procedure for the patient. So we can give some treatment without surgery. For example, just imagine a patient is having difficulty in breathing or wheezing is there. I'm going to give a treatment called nebulization. So that nebulization can be coded with the help of this medicine chapter, and the codes in this chapter will again start with number 9. So 90281 till 99199 and 99500 to 99607 belongs to the medicine chapter. So with this we have completed category 1 section of CPT. Now we'll move to the category 2. I told you before, category 1 will be used for regular coding purpose. So this category 2 and category 3, we don't use much for coding purposes, but still we have to know what it is. Category 2 codes means it is an alphanumerical code that contains 4 numbers followed by alphabet F, followed by alphabet F. So whenever a code is ending with letter F, it says that it is a category 2 code. And for what purpose we use this category 2 code? There is something called as performance measurement. Performance measurement. This is not used for reimbursement or claim purposes. But just imagine a patient is coming to the hospital and the doctor is doing a complete cardiac evaluation. That means heart testing or examination is done. And after doing everything, doctor is noting down in the patient's report with the help of a code. And when the patient is coming next time, he can refer to that code and understand that last time he did a complete evaluation for the heart and what all things were there. So with the help of that code, he can measure his performance what he did last time. So that is the only purpose of category 2 codes. Otherwise, we will not be using category 2 codes for any purpose of coding or claim purposes. We are not using it. So that is about category 2. Next is category 3. Category 3 is also something like a category 2 code. It contains 4 numbers followed by letter T. It's again an alphanumerical code with 5 characters. but it has 4 numbers followed by letter T. At the end of code, you can see letter T. So 0508T is an example for category 3 code. And what is this category 3 code? It is also called as a temporary code, which will be used for new technology purposes or new procedures that are introduced in the medical industry. Every day they will be coming up with some new surgical treatment or new procedures. But immediately once a procedure is introduced, they cannot give a code for it. So what they do is they wait for some time, and after some time they will put it under the permanent section, that is category 1, but till then it will be put under the category 3 section. So that is why it is called temporary code. So temporary codes are category 3 codes. Keep in mind that it will end with letter T. Now on my screen you can see some codes. There are 4 codes. You can try to find out whether these are category 1, 2, 3 codes. So now I'll give you some time to find it out. Okay, now we will discuss. The first code is 00100. It has got 5 numbers, no alphabet in it, and it starts with number 0. So this is a category 1 code from anesthesia chapter. Yes, it's from anesthesia chapter. Next is 70110. It's again containing 5 characters, no alphabets. So it is a category 1 code. As it is starting with number 7, it is understood that it is from radiology chapter. Next is 0467T. So I don't have to say what it is. It is ending with letter T. So it is obviously a category 3 code, that is a temporary code. And 4265F is ending with letter F. So it says that it is a category 2 code. So that is about category 1, 2 and 3 codes. Now we are clear about it, right? Yes. Now we'll move to the next topic under CPT is modifiers. So what are these modifiers? How we are going to use it? Modifiers can be 2 digits, 2 alphabets or alphanumerical modifiers. So modifiers will look like this. After CPT codes, you will be seeing a hyphen, and after the hyphen you can write the modifiers. The modifiers can be 2 letters, 1 letter and a number, and 2 numbers. So what are these modifiers? Why we use them? Modifiers are something to say that we have done some modification in the procedure. For example, I'm going to do a surgery, but the surgery was little complicated, and because of that I took more time. So like I put so much of effort on the patient to do the surgery and I took more time. That means I need more reimbursement or claim for that. So how can I do that? I can use a modifier after the CPT code that will help me to fetch more money from the insurance company. Like that we use modifiers. And for the purpose of reporting a complicated procedure, I can use modifier 22. There is a modifier called 22. So that we will be using after the CPT code to convey that to the insurance company. I have taken some extra time, and as it was in a complicated procedure, it was more time consuming and effort taking. So I did this procedure, I need more reimbursement. So that is the purpose of modifiers. And I'll explain one more modifier here, modifier 50. Whenever we are doing the same procedure on both sides of the body, we use some modifier, that is number 50. For example, we say 50-50 means it's 100, right? 100%. Like that, if I'm doing one procedure on the right side and the same procedure is done on the left side also, I don't have to report the code 2 times. I can report the code followed by modifier 50 and it is understood that I did this procedure on both the sides. So that is the use of modifiers. Like this, we use so many modifiers. We will be learning it in detail when we learn the CPT. Next is ICD. So we have completed with CPT. Now we'll move to ICD. As I have told you before, what is ICD? ICD is International Classification of Diseases, and this will be used for coding all diagnosis. Coding all diagnosis. And the ICD codes are always alphanumerical. It's always alphanumerical. It always starts with an alphabet. For example, the codes will be looking like this: A01 to Z00. So all the codes will start with alphabet, and each and every alphabet has got a particular importance. For example, in CPT, I told every chapter will start with a particular number. Like that, here also every chapter will start with a particular alphabet. For example, when a code is starting with letter A, it is understood that it is from infectious diseases. That means diseases which are caused by microorganisms or infections. So that is about ICD code. And the ICD codes can be very short as 3 characters or long as 7 characters. So now you can see 2 codes here. The first one is E08. It is a 3-character code. Second one is S43.211A. This is a 7-character code. Both are ICD codes. But why do we use this till 7 character? Whenever you have 3 characters, that means 1 alphabet, 2 numbers in an ICD code, it is called as a category code. It is called as a category code. And this category code will be extended till 7 characters for subcategories. For example, a patient has got anemia. Anemia is a general term, but under anemia we have got different types of anemia. So for anemia, there will be a category code. But for the different anemias that is coming under the classification, you will be picking up the subcategory codes that is having a dot, and after the dot you will be seeing 3 or 4 characters. It depends upon. It can be sometimes like S43.2, or it can be S43.21 and S43.211 or S43.211A. So it can be any of these like things. So the code's maximum character is 7 and minimum is 3. Minimum is 3, maximum is 7. And whenever a code is extending after the 3rd character, you will find a dot in ICD code. So if there is a dot, it is an ICD code. If it is starting with an alphabet, it is an ICD code. If it is having 7 characters, it is an ICD code. If it is having 5 characters, 6 characters, 4 characters, but there is a dot, it is an ICD code. But if it is 3 character without a dot, that is also ICD. That is also ICD. So this is how ICD codes are designed. Now we'll move to HCPCS. As I told you before, HCPCS will be used for coding medical supplies or materials. From this you will get 3 questions. And the codes in HCPCS is also an alphanumerical code starting with an alphabet. But after the alphabet you will be seeing 4 numbers. For example, B4034. In HCPCS also, each and every letter will be belonging to particular chapter. For example, if I say A, most of the services for ambulances will be covered under A series of codes. Like that, we use the different alphabets here. And there won't be any dot in HCPCS codes. You won't be seeing any dot in a HCPCS code. But it has got an alphabet, and after the alphabet, you will be seeing 4 numbers. Next is again on the screen, you have 3 codes. I will give you 1 minute to find out whether it is an ICD or HCPCS code. Okay, let me ask the first code, P02.3. Is it an ICD or a HCPCS code? It is an ICD code. Very good. P02.3. It is having a dot. It's starting with an alphabet and it is containing 4 characters. So it is an ICD code. What is the next code? L0629. Yes, it is HCPCS code. Starting with an alphabet but no dot in it. But after the alphabet you have 4 numbers. So totally there are 5 characters. So it is in a HCPCS code. Next is Q02. Starting with an alphabet, having 3 characters but no dot, but still it is an ICD code. It is a category code. P02.3 is a subcategory code. Q02 is a category code. That's it. So this is an easy way to identify ICD and HCPCS code. Next, we'll move on to other topics that are covered in the exam. There is something called compliance. Compliance means the set of rules and regulations that has to be followed by the insurance companies in US. That is compliance. And from this you will get 3 questions in the exam, and that will be given to you later in the class with a separate notes, because it is not available in any of your books. We have a separate notes for it. Next is coding guidelines. What is coding guidelines? I told you we use 3 books. In all those 3 books, they give us some rules and regulations how we can use the codes, how we cannot use the codes. So that is coding guidelines, and from that part you will get 7 questions in the exam. Next is medical terms and anatomy. What is medical terms? Each and every part of the human body has got a medical name. For example, heart. Heart cannot be called as heart medically. It will be said as cardio. And anatomy. What is anatomy? We have to learn about the internal organs in detail, where it is located, how it is protected, how it is working, how it is divided into different parts. All of them will be covered under anatomy. And this we will be learning with the CPT topics one by one when we learn them. And from this you will get 8 questions in the exam. And lastly, in the exam you will get something called as case study. From that you will get 10 questions. So this is the longest part in the exam, and this part will be having very long questions that will be giving you a case scenario. For example, I gave you one thing at the beginning. A patient has come to the hospital with fracture, doctor took x-ray, he did the casting, like that. Like that, they will mention a scenario to you, and you have to find the codes based on the patient's condition. Sometimes the answers will be only CPT, sometimes it will be only ICD, sometimes it will be a mixture of CPT and ICD, sometimes it will be a mixture of all those 3 things. So this part you have to focus more in the exam, and this will be 10 questions in the exam. Okay, now just imagine that you have completed learning this medical coding. You have completed all the topics. Now we are ready for the exam. So what is the next step to go for the exam? So what we have to do is, first thing is you have to become a member of AAPC. So American Association of Professional Coders. First thing, you have to become a member there. For that, you have to register yourself at the website of www.aapc.com. And then you have to pay a membership amount of $210, and this has to be renewed every year. So you have to pay this amount every year to renew your membership. Next is, once you become a member, you will be allowed to take the exam, but you have to pay the exam fee. The exam fee will be $430 if you prefer to take 1 attempt, and if you want 2 attempts, you can give $530. So what is this 2 attempts? Sometimes if we fail in the first attempt, you can take the second attempt without additional payment. But they are actually collecting $100 at the beginning itself. But if you pass it, okay, it's okay. Sometimes they will be giving you some points additionally. After the exam, you will be getting the CEU points. But if you fail once, you can take the second attempt without additional payment. That is 2 attempts for $530. So now you have paid the fees, everything is done. What is the next step? Now you can choose the date and the center of exam where you want to take the exam and when you want to take the exam according to your convenience. So if you are residing in UAE, you can choose the centers based on the emirate where you are living in. And then this exam is completely a computer system based online exam, no paper pen exam. You have to go to the centers and you have to take the exam from the centers. And in the exam, you will be getting 100 questions from all the 3 books. And to be a surprise, this is an open book exam. We would have never heard about an open book exam. What is this open book exam? Open book exam means you can carry the original books of AAPC with you to the exam and you can get your answers from your book itself. But it won't be very easy. You have to know what is there in the book, how to use the book, how to find the codes, how you cannot use the codes. That and all will be learned with the help of class only. So you can carry the books, you can choose your answers from the book, but you should know how to do it. So that is what we are going to learn in the class. Until now, the exam is completely an MCQ based exam, but soon they are planning to start with fill in the blanks. So 100 questions, how much time they are giving us? 4 hours. So for a single question, you can spend maximum of 2 minutes, not more than that. Then only you will get at least 20 or 30 minutes to review your questions at the end. So that and all you have to learn in the course. How to solve the questions fastly. So that will be, you have to learn. You have to learn that during the course. So how to read the question fastly, how to understand it, and then how to answer it, that you have to learn by practice. And the pass percentage of the exam is 70%. So you should get at least 70 marks to pass the exam. And if you get 69, it is considered as a failure. But it's not a problem. You can re-attempt the exam, and the number of attempts are not limited. You can take it how many times you want. Only thing, we have to pay some extra money. That is the thing. But otherwise, you can take the exams up till you're getting it as a pass. So 70% is the pass percentage of the exam. So it's not a very simple thing, but we will make it simple. Okay. So that's all about the intro class for the medical coding. So if you have any doubts, share your doubts in the comments. I will try to answer it. Hope you enjoy this video and my intro class. Thank you.